Hi everyone, I'm Eric Ponce. For this project, I chose to interview Dr. Jacob Bueno de Mesquita. Dr. Bueno de Mesquita is a postdoctoral researcher with the Lawrence Berkeley National Lab of Berkeley, California, and he's also an assistant professor of public health at Roger Williams University. Dr. Bueno de Mesquita has been working at the National Lab since 2021, and he's also been working at Roger Williams since September of 2023. He currently conducts all of his research out of Roger Williams University. While the university does not have a specific population they serve, his research with germicidal UVC currently focuses on the elimination of airborne disease transmission in college students. He states that he hopes to someday implement this technology in public settings, such as schools, grocery stores, restaurants, bars, and also in healthcare settings such as urgent care clinics, hospitals, and medical offices. Bueno de Mesquita states that one of the most important lessons he learned from the COVID-19 pandemic is that the hardest aspect of public health is to get the public to comply with recommendations such as masking and social distancing. He believes that if UVC is incorporated into modern infrastructure, we may be able to better mitigate epidemics and pandemics and reduce both excess healthcare expenditure and the burden placed on the medical system of the country in future pandemics or epidemics. He also has initiated another project identifying the barriers of shifting from gas to electric cooking and heating in homes across Rhode Island. This project specifically seeks to reduce prevalence of respiratory illnesses and reduce harm to Rhode Islanders with asthma, as the state has a higher than national average prevalence across all ages. The work Jacob does ties into essential services to investigate, diagnose, and address health problems and hazards affecting the population. Essential Service 3, communicate effectively to inform and educate people about health factors that influence it and how to improve it. And Essential Service 9, improve and innovate public health functions through ongoing evaluation, research, and continuous quality improvement. His work ties into Essential Service 2 as his research is looking at the many root causes that impact the social determinants of health on college campuses and across the state of Rhode Island. His work ties into Essential Service 3 as he engages his students in designing health communications that are accessible to the public based on his research findings, utilizing appropriate channels of communication that are both culturally and linguistically appropriate, allowing the diverse communities of Rhode Island to understand the health risks that may be present and what can be done in the community. His work also ties into Essential Service 9 as he is utilizing his research to become modes of public health practice through contribution to the evidence base and informing policy-making individuals on the evidence-based policies that could benefit the health of the community. One of the most salient takeaways from the interview was when Jacob mentioned that since many diseases are of zoonotic origin, meaning they originate from animals, we are bound to have another pandemic of various diseases such as H5N1 due to the huge burden placed on the animal agricultural industry to produce animal products. He also stated that we are probably bound to have many more recurrent pandemics in the future, and one of the many ways to reduce them would be to place less of a burden on the animal agricultural industry, such as consuming less animal products or just having more days where lesser animal products are used. Another salient takeaway is that there's plenty of public health work that needs to be done across the nation, but due to the behind-the-scenes nature of the work, that it leads to it being one of the first places where funding is cut. Jacob expressed that it is becoming increasingly difficult to engage public health research due to the lack of funding sources. And I will now shift over to a recent clip of his work in Rhode Island as it was featured in the news. Thanks.
Working on preventing the spread of germs in the classroom because, as we all know, that's where they live and spread.
Yeah, they're using UV lighting to potentially stop the spread of viruses like the flu and COVID. Joe Cortez is live in studio to explain how it all works. Good morning, Joe.
And Kate and Patrick, Dr. Jacob Bueno de Mesquita. He's currently working with his students on a real-world application of germicidal UV. So far, it's been installed in one classroom on campus and the health center. And this is what it looks like. It's a small UV light that's put up in the ceiling. Now, germicidal UV technology, it's been around for years to dispose of viruses and bacteria. But this new technology is called far UVC, which operates on a lower wavelength. Now, it'll shine directly down on students within a given space without causing any sort of irritation to the eyes. So therefore, it's much safer. Right now, locations are collecting data in high trafficked areas to test the effectiveness of the technology.
Also enables us to do is to try to replicate a method developed at Columbia University of colorimetric dosimeters that people can wear on them, and they change colors. It gives us a fairly accurate estimate of the amount of energy that's coming out of the light down into the breathing zone.
This study is still in its very early stages. Dr. Bueno de Mesquita wants to involve more students in continuing to promote the technology and findings on a larger scale. Live in studio, Joe Cortez, 12 News.